Good evening, good morning, good afternoon. Welcome to TMS RoundTable Global. My name is Dr. Tova Goldfein. I'm here with my co-host and divine angel friend and colleague, Rose Hoy from Australia, and she will introduce our guest this week. Hi, Rose.
Good morning. Hi. Good morning, everyone. Good morning, Julie. Thank you for joining us. Now, I just want to do a little précis on this book. Where is it? I choose Elena because it's about ACEs, as we've had in the past. We've talked about that. That's adverse childhood experiences. Now, Julie is going to support us and talk about the effects of early childhood experiences. And I'll just briefly mention that the author is unwell at the moment, and that's why she's not with us. So she's got endometriosis and Crohn's disease. So I believe she could be hospitalized at the moment. So her story basically is she's a world-class gymnast, but her coach was molesting her in the background all the time. Then as a 15-year-old, 3 of them went out one night on the quiet to a karaoke bar. They're only there till 9 o'clock. 3 men surrounded them. One of them, who was Lucia, was actually singled out, and she was taken by the arm and walked into a McDonald's, and there was an empty floor on the top, and she was brutally raped. Now, in her story, she talks about the freeze mechanism and how that caused her to actually be taken away without saying anything because she froze. Then, when she thought she was dying, she became, you would say, disassociated, and she was able to leave her body, and she spotted a glass jar in the toilet. She was able to reach down without the rapist seeing her, smash it, and escape. But she told no one for something like 10 years. Now, really, when I read that book, I thought it's so appropriate to bring it out and share the experience with others so that if something like this has happened to them, they can actually know that it's not their shame. And really, I'd just like to ask Julie, how hard would it be for a developing mind to tolerate someone who was very kind to them, but very inappropriate with them, and at the same time continue on as a Olympian-type gymnast? Of course, she gave all this up because, as she says in the book, what did I write down? I thought my illness was unconnected to the previous events, but she, of course, has realized when she read Bessel van der Kolk's The Body Keeps the Score, she was able to make the link that that's what was happening to her, that her body was actually revolting against what had happened to her. So, Julie, it must be very, very hard for a child's mind to comprehend this and then keep going. Julie's got extensive background in pediatrics and that area. That's why she's agreed to come on and speak to us.
Yes, I think it's particularly difficult at that age when you've had a positive relationship with somebody who also takes on that kind of role of the adult, the guiding person that you look up to then be able to deal with these other feelings that come up when somebody treats you in such an awful way. And I think often, unfortunately, culturally, we neglect to teach our children that they can make a stand with adults, or if they're not comfortable making a stand with adults, that it's important that they come and talk to somebody else and that they'll be listened to. And then there's also the extra issue of that there's still a lot of shame around any kind of assault that's sexual. Fortunately, I think a lot less than there once was, but there's still way too much shame. Somehow there's something sexual, again, that we tend to be conditioned to be more likely to keep quiet and not to speak up. So, and I think the story is a very relevant story of what can happen for any person of any age, but I think it can be much harder for younger people to be able to talk about what happened to them, which I think is also something that stands out in the story, is that she stayed alone with her trauma for a very long time. You know, the trauma itself was an awful thing that should never have happened. Then that somehow, and it wasn't her fault that she stayed alone with this until finally she started realising what was happening and how these events fitted together with labour events and her physical suffering, and started finding
Julie,
the
I'm
right
going to
people
interrupt you
speak
for a
to.
moment, Julie, because I heard this in the beginning, and I want to know if there's something we can do. There's a bit of a delay or an echo out to the Facebook page, and I hear it also. And I don't know if we should go in and out again, or we should try without the headphones. You know what? Is your sound up, Julie, in your computer? Sometimes when the sound is up high in your computer, it might echo.
Oh, you want me to put it down a little?
Check your sound to see if it's down, the sound in your computer. And then let's hear,
That,
do you hear it, Rose?
I think
Do you hear the echo?
Yeah. Well, I think it's the internet. It's sort of like this noise comes up on and off.
Okay, well, let's just continue. So I'm sorry, I didn't mean to interrupt, but it's fascinating what you were saying. You were talking about, of course, shame in people, and Rose, as Rose mentions a lot about the guilt, the shame, and then what's behind that is the guilt, and then the anger and the chain of emotions.
mm-hmm. And I think as well what woman describes is what can often happen when we get very anxious. Our brain releases chemicals and we have a freeze response. And again, that wasn't her fault. That was her body working in a biological way that we're designed to work when we get very anxious. Only again, it can lead to more of these thoughts that somehow I should have done something. It's a very difficult mechanism to overcome. It's why our military and emergency services get this repetitive training in being able to act in dangerous situations, so that when they're in a dangerous situation, they have habitual learning. Because it's, again, once you have your brain releasing all these chemicals that result in the freeze response, yet it can be very hard when you tell your story. People say, well, why didn't you do something? Well, because your body's acting in a way that won't let you, and you're not trained to want to deal with a situation of sexual assault or rape. So, and I think if you look even biologically with animals, a lot of animals in a risky situation will freeze, and a lot of animals, they need a moving prey in order to keep attacking. A lot of animals will not attack a dead animal unless they've killed it themselves. Okay, when we understand all this, it really makes sense why this mechanism is adaptive when we're at risk. Only it can also really impede you at risk in a way that perhaps take action. And some people do take action in the moment. Somehow they overcome that mechanism, and then it leads to them getting more hurt. So you don't have the luxury in a situation like that of being able to think through, what's my best course of action right now? Should I yell out? Should I stay quiet? Should I go limp? Because your brain's shut down. And again, all of us experience brain shutdown at very high levels of anxiety.
Wow.
Only later on, trying to explain to people, well, why didn't you yell out? Why didn't you try and do something? Well, possibly because your body is letting you.
Right. So I just have to say this interesting. There was an article when I first started getting into body mind work many, many years ago. And it was about a Navy SEAL who was being trained for his job. And all these people were trying out, all these men were trying out for the Navy SEAL job. So one of the things they had to do was be tied up and be put underwater, and they had to undo themselves underwater. And some people died because they didn't do it the way that, in other words, if a man would go under and he had to undo the rope and get free, that was his training, and he would be accepted in the Navy SEALs. So one guy went under. He was calm. He slowly untied the rope. He would pop up for a little bit of air and then go down. And he didn't resist. He calmed himself by the breath and the brain. So the point I wanted to make is, who gets trained to do that but Navy SEALs? So maybe there should be a training we do in our schools to help people. Like now we do, karate, and I learned some kind of Israeli. I learned, Israeli defense. So it's something maybe in the future for us to protect ourselves.
And I mean, maybe perhaps we could also learn just to be more acquainted with our bodies full stop as well. To be able to pay attention to what's happening physically and emotionally, and to be able to talk about that. So, and then I think the other aspect, which it sounds like you've had lots of conversations with Ro, is this of what happens when you have a lot of anger or rage stirred up to someone. Again, often we learn to be anxious about our healthy anger, and then the anger there. I mean, even just reading through the story, I think it would be hard to read that story without feeling a lot of anger towards the man that did this to Lucia. But at the same time, if you get anxious...
Well, the anger towards the coach as well. Yeah.
Well, yes. Yeah. And then it can also ripple out
to the coach.
And to anger towards the people that you love in your life that somehow are going on with their lives. Well, your life on some level has stopped. But of course, if you're not able to tell people, then they're also not able to help you. So, and then when we avoid that anger in ways that put it back in our body, I mean, sometimes emotionally, that's when we end up suffering from depression or from harsh critical thoughts, or it can go back into our body and physical symptoms, which sounds like is what happened to Sia. And then we get to avoid the anger because we're buried it in a way that really hurts us. We kind of almost let the other person off the hook, but a huge cost to us.
Well, Lucia's story actually ended up in a court case in Sydney, and it was well documented. And now, of course, she's brought it out in the open so that, more young people can see that it wasn't their fault. And, the other thing that struck me was that Lucia tolerated this for a long time, and she's able to focus on her body, because for all intents and purposes, that's what a gymnast does. She focuses, she's precise, she's able to do all this and actually put aside what the coach was doing to her. And as I read it as a parent, you think, well, if only she told her own parents. But obviously the fact that they were groomed is what I'm trying to say, weren't they? The parents were groomed as well as the child. So now as adults that are maybe watching us at the moment, when they blame themselves for what happened, it was a whole system that was being tricked, I suppose. Like the parents were tricked and the person was tricked. And then, of course, they've got the burden then of guilt. So, can you talk a little bit more, Julie, about that burden of guilt that isn't your guilt, that it's the perpetrator's guilt?
we talk about healthy guilt when you've done the wrong thing by somebody, and that should mobilize you to take responsibility and seek to repair. And then there's what we call pathological guilt, when you feel guilt over something that isn't your fault. And that's a very destructive mechanism that often leads to a lot of self-punishment. We talk about self-punishment is actually,
and also, you know, once Lucia was raped, she was no longer able to. She was part of the Olympic gymnast team, and she gave up on that. And it's sort of like it becomes self-defeating. Something, I don't know. Is it sort of like a personal thing? You know, this has happened to me, so I'm never going to be any, like I'm broken. That sort of concept. You know, and people with chronic pain have that notion that they're broken, and yet it's the mind that's doing the job, not their body.
And I think, I mean, I don't know, you know, in Lucia's case exactly what her reasons were, but there can be a number of reasons. One, that association with the early sexual assault. Also, it can be hard to do anything if you're very emotionally affected. It can be hard if your body's hurting. But, you know, then there's all these mechanisms that lead to us experiencing loss, type of loss. And often engaging in sport in that level can be, it becomes part of your identity, and it also be a way that you actually get to deal with feelings, get to, we often call it a healthy avoidance mechanism, by channeling those same kind of feelings into something where your body gets something out. But you know, at the same time, if you have association and if your body's not functioning properly, I imagine that it would be a very hard thing to continue with. And I think also dissociation can be, you know, one of the mechanisms in the first place that often young children have this mechanism, almost if they can't be something, then it doesn't exist. And I think this mechanism, of course, as we get older, we develop more of a kind of recognizing rational mind, but to some extent it can still stay with us, that if somehow we don't think about it and don't talk about it, then it'll go away and we can pretend it didn't happen and we'll suffer less. Only generally our bodies don't work like that. It'll still stay somewhere.
That's right.
That we just bury it. That can also be a factor, that if I don't tell people, then it hasn't happened.
Oh, right.
Yeah. Well, that's what Lucia says in her book. She actually went to school the next day and talked about the songs they sang at the karaoke place and the fun they had. And she ignored. It didn't happen.
Try and focus on positive and pretend that the very negative, terrible side didn't happen. So, you know, again, this is just a way that people try to cope. This is a way that people try to deal with the trauma, only at the same time it's not her fault, but we can understand why then trying to bury it just leaves the pain and also the rage buried in her body in a way that then causes problems.
Yeah. Well, you know, when I read it, I also thought about how kids, when something goes wrong, like they've got an alcoholic father, they've got other issues going on in the family, and they'll come to therapy, for example, and they won't talk about that. They'll say, oh, well, my family was really, the first thing they'll say is, well, you know, my family life was really good. And then after a period of time, the grief comes up about how it wasn't so good. And that resonated with me when I read that book, that it's so typical for us as children to always think that we've got the ideal, to keep you safe.
The ideal
that's
home.
where I'm coming. Yeah.
And if we can tell the right story, it'll make it true. So in some ways, this is also an adaptive mechanism to try to focus on the positive, to try to pretend it didn't happen, but it often just doesn't work.
Yeah.
It also hurts us at the same time. So, again, children are very good at learning what causes less friction with their parents. And children are very good at learning to keep their parents regulated because they want to preserve the attachment relationship. And, even with the best of parents, it can be easy to say to a child, not now, or you'll get over it, or it doesn't look that bad. It's not that the parent doesn't love their child. It's just that these can be very easy words to say if you think that there's something minor and the parent's busy with other things in their life. But if a child hears that often enough, then that's what they'll internalise, and they'll learn that when they hurt, it's not a big deal. Or when they hurt, well, maybe there's something pressing. And then again, of course, when there's sexual assault, there's the whole additional issue of that culturally there's often been shame attached to that. And again, much less so these days, still way too much. And then, it just becomes easier to try to pretend it didn't happen and to hope it will go away, and maybe then you'll have to forget about it. That's why sometimes then people start using alcohol. You can usually see it clearly whether it's physical symptoms in the body that cause suffering, whether it's, say, the excessive use of alcohol and drugs. When depression comes in, there'll always be a clear trigger where someone is either consciously or unconsciously trying to bury trauma.
So you're saying that, like, what I'm hearing from you is that we need to talk about it, or it's better to talk about it, to accept it, to be responsible for that it happened, that no one's to blame, but that I'm responsible for how I move on with my life, and that things like this kind of pattern of moving on with it would that be the way that one would heal more effectively from this? Like, maybe we can talk a little bit more about, well, okay, it happened. How can I heal? What are some of the tools that I can do that we can just, what would come naturally besides in other words, there's fear, there's guilt. But if somebody accepted it, I mean, there are people that survive rape and survive childhood molestation, and they're okay. And, we're here to, have our patients and clients believe that everything can be okay, that not to stuff it. But what are some tools with or without the therapist that they can do?
Well, I think there's two things. One, to find the right person to talk with, to not leave yourself alone. I think that's an important first step. I think people like Lucia are very brave to speak publicly, because I think that's a wonderful thing, is that then it helps other people who have been in the same situation, or people who haven't been in that situation, to have more understanding, and also to realise that you can help. But I think, to find the right person to start talking with, and if that first person is a parent, and the parent isn't sure how to deal with it, then together to find the right kind of professional person you feel safe with to talk to about it. But I think the second part is, once you realise that the actual physical trauma, often we heal from that very quickly. Terrible thing that happened, physical wounds heal, and then what causes the ongoing suffering isn't actually the event itself, it's our feelings about the event. So for most people, the actual attack, the injuries will heal. Only what perpetuates the suffering is, again, often, enormous rage that they get anxious about, that then gets turned in on themselves, or that they avoid in ways that hurt them, for example, with alcohol and drugs, and the anxiety, the guilt, all these emotions, causes the lifelong suffering. And so
Yeah.
I think once you realise that, that's very powerful information, because that can be dealt with. And it's really about dealing with these feelings, about being able to face the feelings, being able to experience the feelings, rather than burying them or avoiding them in ways that hurt you, that mean that you can totally heal from this.
Right.
Only, again, it's finding the right person to do that with.
That's the problem,
Again, I think
isn't it? Yeah.
yes.
What's the
I think what
problem
we
and the
did,
solution? It's the problem and the solution.
and I think it's
Yeah.
very courageous to speak up, because again, once you do that, it's out there, and you can't bury it anymore. Sometimes we want to selectively pick and choose, and that makes sense when we talk
Yeah.
about it, when we bury it. But at the same time, I think very important for people who are able to speak up to do that, so that other people aren't left alone, so that they realise that that they're the only one that has been through this. And again, people who haven't been through it, so they can start to get more understanding. It wasn't her fault that she didn't call out for help. It wasn't her fault initially. She tried to focus on the positives and pretend it hadn't happened. And that these are just ways of trying to cope, sometimes biological ways, sometimes emotional ways. But unfortunately, they can also perpetuate the suffering when you keep yourself alone with it for a long time. Or for some people, I mean, I think in Rose will probably, and you probably yourself experienced elderly people who have carried trauma their entire lives. I know I've worked in a rural community here in Australia where there can be a lot of shame and self-judgment around having some kind of emotional suffering. And so fortunately now that there's more understanding and we're getting medical practitioners refer these people for psychological treatment, they start to realise, well, I'm not the only one who has anxiety, because they look around, nobody talks about it, don't realise that 1 in 3 or 4 people will suffer high anxiety at some stage. And it's wonderful that you get people at the age of, in their 70s, 80s, finally getting help for their anxiety, for their trauma. So sad that they couldn't have got help in their teenage years or their 20s. But I think we're heading in the right direction, but we've still got a very long way to go with this.
Right.
Yeah. One of the other things that I reflected on in the book was the fact that Lucia was a perfectionist. She had to have everything right. She'd go to bed at night planning her moves the next day for her competition. And I thought, how sad is that? But she's so focused on being able to do that so perfectly, then everything gets shattered. And then she goes back and then blames herself. And I thought, can we just sort of just expose a little bit about how when we want to be absolutely perfect and then something goes wrong, we just sort of read ourselves as broken, or, we're not able to cope anymore. I mean, Lucy is a solicitor, I think, and an author. So she's got a really well-developed adult life. But again, underneath that, she's got Crohn's disease. So every time anxiety comes up for her, she turns it back onto her body again and collapses. So, that whole idea that the disease I've got, I don't know, is it a protection, do you think? A protection for some reason?
Yeah. Well, I think it protects you from facing your age.
Yeah.
So, and again, it's just an automatic mechanism that we often get taught to avoid angry feelings. And again, you can think back to childhood, even a loving parent, unfortunately, will sometimes just use their child's healthy anger. Rather than being able to say, I understand you're angry because you want an ice cream and you're not getting one, and you're still not going to get the ice cream, but I understand you're angry that you want another ice cream. We will say, what are you complaining? You're not having an ice cream. You've already had lollies. And encourage a child to dismiss their healthy anger. Or we'll just say, you've got no reason to be angry. You've already had lollies. Rather than being able to validate the feeling, while still setting boundaries. And then again, there's just a long history of the way that we learn to deal with our feelings, rather than children being able to learn that all their feelings are healthy and normal. Anger is not a problem. Anger is a normal, healthy feeling. It's how we act on our anger that can be a problem. So if we get anxious about angry feelings and avoid the anger in ways that either hurt us or lead to it coming out in ways that hurt other people, then that's a problem. But it's not the anger itself. It's anger combined with anxiety that leads to acting on it in ways that can really hurt people, or internalize it, including sometimes it ends up like an attack on our body.
So I like that. Healthy anger, healthy guilt. See, this is important because we are labeling the feelings, and there's negative and positive, and I think it's important to balance, as we're always talking about balance. Healthy anger, you said healthy guilt. I just quoted you. Anger is a healthy, normal feeling. It is about the way we use it. So same with guilt and the same with shame. Sometimes it protects us. Sometimes it's good. Like when you talk about health, can you talk a little bit about healthy guilt? What would be an example of healthy guilt?
Say if I, was in the room with you, arms around, as I do sometimes when I talk, accidentally hit you in the face, just saying, I'm so sorry, are you okay? Do you need a cold pack? That's the
so I might feel guilty that I accidentally hit you, and that's healthy. It's okay. I'm allowed to feel bad.
Yeah.
But if I have a nightmare that night because I felt so bad, then something's deeper for me about.
Yes, it's got to activate. Or if I spend then the next half hour thinking, oh no, I hit Tova, I hope she's okay, she probably hates me. That's not. We call that self-punishment. And that can actually be a defense against healthy guilt. And sometimes one of the signs is someone who just takes responsibility, says sorry, and tries to work out what can they do, if anything, to make repair. Sometimes we get people that almost do what we call this wallowing, where it's almost designed to have, and so Rose will end up going, no, Julie, it's okay, you haven't done anything wrong. It's designed to get someone to encourage you to avoid healthy guilt. And that's not healthy. Rather than just going, you didn't mean to do it. Just take responsibility. You hit someone's car. You didn't mean to do it, but take responsibility. Leave your registration number. You're not there. And that's just the expression of the guilt. But also, the guilt attached to our rage. Some of this can happen on an unconscious level, where if somebody hurts this way, again, we have the normal emotion of anger, only it can often, again, be buried, and it all happens on an unconscious level. And then because we have this anger, then hand in hand with anger is our unconscious guilt. And if we're not really aware of these processes, one, we can't deal with them, but two, they'll still hurt us. So that's the difference between facing anger and facing guilt that goes with anger, and being able to process it versus bearing it. So, and like self-blame is just an avoidance of either health guilt because you know that you've done something, or sometimes there's this unconscious guilt that that if you're carrying a lot of rage, because of our humanity, because we're not psychopaths, because we don't want to hurt people, but the impulses that can go with our unconscious rage can also attract this unconscious guilt. And then if we're not aware of that guilt, it often operates in a way where we hurt ourselves. Other than being to face our anger towards somebody else, we bury it in ways that hurt us, and the same thing that will go with that.
So true.
And then we get Crohn's disease or something. Jean has commented here about should. Yeah. And I thought, could we have a little look at that?
Yes, I'll bring it up. Yes, here. Here's Jean's
Well,
comment.
should've,
Can you say
yeah.
it, Rose? I hear the
I'm
word
looking at it
should.
on the side of
I
the
hear the
screen.
word should when one feels or believes they should have done this or that, but did not. They will experience feelings of guilt. When someone tells another what they should have done, the person is likely to experience feelings of shame. Anger, frustration, fight, or flees are may very well be coping instincts. Very
And
wise.
yeah, it's easier if you look at specific examples, but generally in that situation, if someone tells you what you should do, that's probably going to go towards them, particularly someone who doesn't really understand what you went through and why you chose certain course of action. So I think that's why, even in psychotherapy, it's very important that we never tell anyone what they should do. We're just there to offer an opportunity if they want to. Only the individual can decide what's right for them. And only the individual knows, really what was happening at that time. The rest of us can try to imagine when we read the story. But I think, once we get into should, we're on very tenuous ground in that, it's very easy to tell other people what they should do.
Very
And
true.
even in a psychotherapy situation, nobody should talk about their trauma until they feel safe, they have the right conditions, and they're ready. So the therapist is just trying to create those conditions. Only the individual knows when it's the right time and what they should be doing for them.
It's true. I want to, there are people watching, and I would love to, if anyone has any questions, what you said earlier that struck me, maybe it's the name of my book that I want to write, is that, anxiety is a human condition. Michael Galinsky says this a lot. We grew up thinking anxiety was bad. Anxiety is a human condition, and it can help us. But of course, in balance to extreme, it can hurt us. So, I think I'd love you to speak about that so people don't feel shameful or guilty about being anxious, because it is a human experience.
Well, and from an ISTP perspective, we see anxiety as letting you know that there's a feeling coming up, and that feeling is useful. That feeling's there to give you important information about a situation or a relationship. So we'll talk about signal anxiety. So if we can use our anxiety as a signal and look for the feeling that's coming up, then anxiety can almost become like a friend. It's when our anxiety operates in a way that hurts us that it's a problem. But if we constantly have high anxiety and it's not into symptoms in the body, or sometimes people are constantly aware of having mini freeze states. If they constantly get high regulated anxiety, they'll experience mental confusion. They'll experience this kind of brain freeze where they can't think for a moment, and that's something that can really hurt you. But anxiety at lower levels will just let you know that there's something happening right now that I need to pay attention to. We always also distinguish between fear and anxiety. So there's the emotion when there's an imminent risk to the life or the life of somebody else. Anxiety is the feeling we have when there's a risk to the relationship, and there's a feeling getting stuck.
It's also very good. It's very good. But it is something to stop and notice and observe and respond, not react, just to look at, observe, there's that anxious feeling I'm having.
And also if you get,
which usually about
if your anxiety operates at unhealthy levels that hurt you, to learn to be able to experience your anxiety. You don't want to avoid your anxiety, but to be able to stay regulated so that you can feel your anxiety, but in ways that don't hurt you. And then, let you pay attention to what feels getting stirred up. So that's why, again, in therapy situations, sometimes one of the early tasks is to help somebody to stay more regulated with their anxiety. We don't want to say, well, we want to get rid of your anxiety. The anxiety is useful, but we do want people to be able to experience their anxiety in a healthy way that just gives them that useful information that there's something happening they need to pay attention to, rather than go to high levels will then hurt them.
Excellent. Excellent.
Yeah. Well, the anxiety that would come up for Lucia every day that she'd be going to her gym practice would be to go to a disassociation area, wouldn't it? That she'd be able to tolerate the intrusion of the coach and still perform well. And you know, the other thing that crossed my mind is the pleasing of the parents. Like maybe if she told the parents that the coach wasn't so good, she'd displease the parents. And where it sort of came back to me was you were saying about the ice cream and the sweets. How you know, you've had ice cream, you've had sweets already, you don't need ice cream.
Yeah.
You know, if that's the dialogue within the relationship in the family, all those personal feelings have to be put aside, because I'll risk my relationship with my parents if I tell my parents that I'm being molested. Does that make sense?
Complex. Yeah. There's probably lots of factors involved, wanting to protect the parents from suffering, concerned maybe about blame, wanting to be able to keep this relationship, which also had the positive aspects to it of someone who was able to teach and train, wanting to keep parents happy. So there's lots of aspects to this. I think that, again, that, you know, it's not necessarily a straightforward thing to do, but if you can help a child from an early age to understand that their feelings are there for a reason and all their feelings are acceptable. It's about being able to use feelings and act on feelings in healthy ways. You know, having a tantrum in the supermarket isn't going to help you get lollies. Although, again, you know, sometimes as parents we notice that we need access to our own anger in a healthy way, to be able to just stay calm and set limits. That when you set limits with your child, you need a healthy relationship with your anger to do that, where it comes out of love and you're able to just stay calm. You don't get overly anxious. You just stay consistent. You know, again, we're humans, where we've all got our own history with feelings, and so this will be passed on to children. But one of the good things these days is that we have access to a lot more information.
So true.
We have access to ways of learning, whether it's how to try to be better parents, how to try to be better humans, how to operate in relationships, and also options for if you experience high anxiety or trauma. So, it was wonderful. I mean, the fact that you two are doing these events, there's so many more options these days. I mean, I imagine 100 years ago, nobody would have been talking about sexual abuse.
Right.
It was all
well, you know,
totally...
Julie, I so believe. I mean, my mother had MS, and I grew up in a house where there was a disease, and I just grew up thinking if the body can make it, the body can heal it. Like, I think the future is the doctor inside of us, and I think that this is not unreachable. Oh, okay. This is not unreachable education that people can learn this. Don't you agree, Rose? People can learn this. This is not just for the doctors and the therapists. This is, things that people can learn and apply and implement in their lives. And they can heal themselves. They can heal themselves.
Yeah.
But that's a little bit simplistic in a way, because we've got all these other elements that we've just been talking about, like attachment. How does our attachment with our caregivers work? Do we have to be compliant all the time, or can we allow our emotions to come out? Are our emotions okay to be dealt with? Do I have to use anxiety to block my emotions down? So all that sort of stuff has to be brought out first. And then the body then goes into vasovagal rest, I suppose you might say, and then the body can heal itself. So the mechanism is not in your intellect, it's actually in your body, in your focus.
Yes.
When your vasovagal system is calm. You know, I mean, I love that nun study that they did in France, and the nuns agreed to autopsies when they died, and these old ladies were in their 90s or hundreds, and when they did the autopsy on them, they all had what we call Alzheimer's, but they were all
Right. Amazing.
fully functioning when they died.
Yeah.
So it
Yeah.
tells us that the anxiety is happening in us, and that anxiety is not able to regulate our body because it puts us in fight, flight, or freeze, as we said. And that's why Lucia's book goes through the whole 3 systems of fighting, flight. I'm getting tongue-tied. Fight, flight, and freeze. So it's not, you know, when we sort of present that idea that our body will heal, yes, Bessel van der Kolk says the body keeps the score. So while the body's keeping the score, our mind is sort of racing instead of letting the mind go and allowing the body to calm itself.
Right.
So,
Right.
yeah.
Right. So Lori's making a comment. I know it's a question. Shalom, Lori. I've not met you before. Welcome. So is anxiety not a feeling in itself? Is it more of a signal that emotion needs to come to awareness?
Perfect.
As a signal, there's a feeling being stirred up. That's why we call it signal anxiety versus the emotion of fear when there's an imminent threat to life.
So explain that to me again. So I want to just read this again. Anxiety is not a feeling in itself. It is more of a signal
That there's a
that I
feeling.
need to, that there's a feeling there somewhere. The anxiety is telling me I must question, I can question myself. What am I feeling? So this is a tool. This is a home tool. I feel anxiety. I'm feeling shaky. Sweating. Dry mouth.
Yeah.
What is the feeling?
Yes.
And then what do we do with that feeling?
Well, then again, if we can feel our feelings without excessive anxiety, then we'll have useful information that we can act on to have better relationships or to take action if there's something happening in a relationship that's not okay. So if we have access to our anger in a healthy way, then we'll feel strong, we'll know that there's something that's not okay, and we'll be able to use that to speak up. Find somebody, again, this is where, you know, children sometimes need their safe person to speak to and to have a person who can take action on their behalf. Sometimes it's not always possible to take the action, but at least you can feel your anger without excessive anxiety. You'll also be able to think clearly. You'll be able to work your options and you'll be able to choose the best option in the situation. So it's something that I find wonderful in working with children is when you have the parents sitting in the room and when you help the child to understand. So the anger that came up when they hit their brother teasing them was the healthy emotion. Only it's the way that they acted on their anger that actually caused the problem. And you know, when I go through maybe, you know, the scenario with you want thing in the supermarket, the ice cream, a kind of version of that, and parents are sitting there and they start to realise, right, so actually my anger, child's anger is okay and healthy. It's how my child acts on anger that's the problem. And I'm the one that gets to help them with that, to shape that. And then you can see also that they start to realize, so, right, so my anger is healthy. And our feelings are only a problem if we get anxious about them. If we don't get overly anxious, if we're able to just experience signal anxiety, but in a fairly calm, low level way, then we'll just have access to a feeling that will give us some important information and we'll be able to act on them in a healthy way. It's only if we get excessive anxiety and we get too anxious to face the feeling that we end up acting on it in ways that aren't ideal or avoiding bearing it in ways that hurt us. And I mean, it's wonderful that they're introducing meditation in schools. Wouldn't it be wonderful if we introduced programs to just children to accept their feelings, to identify their feelings, to know that their feelings were there for a good reason, and to develop better options for how to act on them, so that they didn't have to get so anxious and bury them, avoid them, hurt themselves, channel them in ways that are adaptive.
Wow.
Yeah.
And often, children are often good teachers to their parents as well.
Well, that's true. The child has got an open sort of screen or a mind. They tell the truth, and then they often get into trouble for telling the truth. Actually,
Yeah.
that I mean,
Yeah.
again, Lucia talks about that too. Yeah.
Right.
Yeah. And I haven't only read the article that Sandy wrote, which I was very moved. Article.
So,
I want to read a book now. But as well, I don't know what happened with her, but with a lot of people that, there's the trauma, and then brave enough to speak up, and legal action takes place, or maybe they don't speak up, maybe somebody else calls the police, and then that in itself can be a very difficult process in trying to get something through the courts for lots of reasons. Again, that I think she's done a very brave thing in speaking up in this way, and hopefully opening a path for other people, so that they know that they don't have to suffer alone, and also bury their feelings in ways that hurt them. I guess we can only get here, but maybe she'd been able to help early on, she would have ended up with this whole process. Again, if we can, the earlier we can intervene, then the less suffering, hopefully, if we can help people just to be able to, one, heal physically, but then also to be able to deal with the feelings in healthy ways. We can circumvent years of suffering, and also intergenerational suffering, where then people will pass on their ways of avoiding with feelings. They don't mean to hurt other people, they don't mean to hurt their children in doing that. It's just that we can't help our children if we don't know how to do something ourselves.
Exactly. Look, the other thing that is not mentioned in this book, not that I can remember anyway, when people have a sexual trauma, they also then have issues with their own adult sexual relationships, and they need to be able to work through that, like a feeling of being cold when someone gets close to them. That old feeling comes back. They want to be close to their partner, but then their partner then becomes a threat. Can we just sort of expose that a little bit so that people can normalize that this is a response to a previous trauma, not the particular partner?
Yeah.
It's
be protective in a way, but it's kind of like the body's protective system just goes a bit skew. You can think of it in a basic level that if you don't let anyone get close to you, then nobody can hurt you again. And I think it's also important to realize it's not necessarily sexual trauma. This can be the result of other kinds of physical trauma, but it can also be the result of emotional trauma. Without there having been any physical trauma, that if you've been hurt in a relationship, then letting anyone get close to you, whether it's physically, emotionally, or both, is also meant to be protective, only it doesn't let you actually develop that capacity to be able to stay regulated with your anxiety, to be able to use your feelings, to be able to individually assess people. Almost as if everyone gets lumped in the possible risk category. And again, a lot of this will happen automatically in the body, where the individual doesn't get to choose. It's a whole unconscious process that takes place. Then the body kind of, just puts up a barrier with everyone. So again, the way to stop people hurting, only in and of itself, it will hurt you in that you don't get to have close relationships with those people that will actually add to your life and that don't want to hurt you.
Yeah. I think that in a way, often the romantic partner sort of has like it's sort of like a ghost from the past sort of comes in when people have romantic feelings about someone, and then when they want to get close to that person, the old fear comes back into the body somehow, and
Yes.
creates anxiety that as you said, Julie, they could get hurt again, and yet it's not going to happen. But that belief, what would you call it? That understanding that this is dangerous, and the mind works as a danger, and I suppose blocks the feelings down. Do you think?
And again, a lot of it's unconscious. It's not as if the person goes through a process where they think, my partner is trying to get close to me. If I keep my partner at a distance, then he won't be able to hurt me, so I will keep him at a distance. Often the individual wants to get close to their partner, only again, their unconscious processes get activated, and then they respond physically and emotionally in ways that distance. And then considering that, everyone kind of has this, you don't get many people that are kind of fully emotionally, physically functioning, that are totally comfortable with all their feelings. So it can often trigger a vicious cycle where the partner has the experience of being rejected, the partner has the experience that there must be something wrong in her or him. They bring up their own anger, whether it's conscious or not, and then they can start to put their own distance back, and it just starts this vicious cycle. So
blaming.
Again,
Yeah.
It can just perpetuate this the suffering.
Yeah. Well, you said activated, and I thought, I wrote that down as a sort of like a key word, that loving feelings activate the old trauma. So
yes,
for
somebody getting close meant somebody hurting you.
Yeah. So anyone listening at the moment, be aware that will remain on the internet for the next few hours. So any questions or whatever, or any problems that come up from listening to this conversation, please know that there's someone at the end of the computer. Also, we all have in our own cities places we can go, a lifeline type responses. So please, if something's coming up for you now about how you shut down, and that cold feeling is coming back to you about having been traumatized so deeply, please reach out to someone. Don't just walk away from this program and think that this happened to me and I'm hopeless and I'll never get better, because that isn't really the case. The case is that you can get help and you can get support.
Yeah.
So keep that in the back of your mind.
Yeah. So Lisa is saying, I wonder if you might be able to comment on how a person develops or increases the capacity to be present to their body when the trauma developed. When the trauma had wired them to avoid, what's that word, Rose? When the trauma
developed.
Anyway,
no.
Developed, had wired them to avoid it at all costs. So
cost.
Yeah. Do you see?
Well, that's what we were saying. That we become activated and we want to protect ourselves.
Yeah.
And this sounds simplistic in some ways, but it's as eventually you can face your feelings without anxiety, you won't need that mechanism of checking out in relationship. Some people, it's for conscious checking out, they'll consciously avoid a relationship. For other people, there's automatic processes happen, whether it's dissociation condition, some other mechanism that doesn't let them be present.
Right.
So usually what I say to people is that this is your body trying to protect you. Once you get to the stage where you can feel these feelings, including being comfortable with healthy anger, so that you're confident that you can say no or you can set boundaries, then this mechanism will tend to drop, because the body doesn't have a need for it anymore. But at the moment, your body is just trying to protect you still. So again, there's parts of it that it's meant to be adaptive. It's meant to be a mechanism that prevents the person from ever getting hurt in the same way again. Only it hurts them, it perpetuates the suffering, and it doesn't let them choose who they're close to.
I want to say something and sort of help me with this. So Rose and I are blessed to work with people, and they have really, the body's really protecting. There's an enormous amount of symptoms going on in people's bodies. And they might not have had the extent of the trauma that Lucia has had. But so it's not, I know Rose has said sometimes it depends on when the trauma happened, but now we're talking about what kind of trauma. And again, big trauma, small trauma, it's really the way that we perceived it, that we received it, we just made a decision at that time to deal with it. And that's what's happening today in the chronic pain. It's sort of how it ended up with me, as opposed to this happened or that happened. It's however what my body did with it. And now, so I think what I want to say is that doesn't matter the trauma. The body can heal it. Big, small, wide, narrow. It's the way that we're riding that wave, depending. See, can you help me with this?
Well,
and what I'm saying?
Yeah, because when we come to realize that our bodies are suffering because we're avoiding feelings in ways that put them back into it. Either our bodies suffer either because of the high unregulated anxiety with conditions like Crohn's, with some people experience dizziness, blurred vision, having blanking out, that are signs of high anxiety, or else avoiding their feelings by burying them inside of them. That in these situations there's enormous rage towards these perpetrators, and then there can be rage towards other people as well, even towards colleagues who get on with their lives, who don't have the same barrier, who go on to be successful, when somehow you end up crippled by your body. It's, if we get anxious about that rage and it goes back to our bodies, it attacks us in ways that hurt us, whether it's pain, whether it's autoimmune conditions, whether they're all assaults on the body. So again, it's about if we can just help people to be able, in the way that they're comfortable with, at the right place for them, to be able to access those feelings without excessive anxiety, then they'll be able to release them.
Yes. So this is Lisa's comment, and we do apologize. We do apologize. There is a little bit of some difficulty with the internet, so I will check it, because it's happened last week also a little bit. So we're happy that you're staying with us, to our audience, a little bit. I mean, we are from Australia, Israel, into the globe, and we're so blessed. But Lisa commented again. She says, it sounds like you're saying it's not an intellectual process. She likes the way you're explaining it, Julie, that the body does the healing. It's very hopeful. Yes, it's hopeful.
Again, if you I think often traditional Chinese medicine, can provide some kind of an analogy where, in my limited understanding, what they seek to do is remove blocks in the meridian systems. And they believe that if you remove the blocks, then the body's own meridian system, the energy in the body will heal the body. And I think it's the same with emotions. systems that we end up suffering because of blocks. Often the anxiety causes blocks. Once we can help the patient to those blocks, then the body often becomes self-healing. And not only that, but it's adaptive going forward when people have a healthy relationship with their anger, and realize that they can use it in a protective way rather than getting anxious and it ending up in an attack on them. But yeah, it's very much, I think there's an intellectual part understanding the process, but it's very much an emotionally experiential therapy, where being comfortable with the actual experience of the feeling, you're being comfortable with the intellectual concept is one thing, but actually what's healing is being able to face that physiological experience of the feelings without excessive anxiety, including that when you look at some of the memory reconsolidation work, that when feelings are experienced very deeply, then it opens up the specific past memories and makes them available for reworking. And then those memories store differently so that we just don't get triggered in the same way anymore. But you need deep physiological activation of the feeling for that to take place.
Yeah.
Excellent.
Well, that whole notion of having the memories reconsolidated and having that meridian, I like the way you said that, like those meridians open again through memory reconsolidation, that once the fear is faced and recognized as not helpful, I suppose, and
Maybe
then
like
the memories
like
come back and become
maybe like the remember the docu-therapy, Rose, where some people who go back and, like, she wrote a book, Lucia, and so she documented her trauma and it helped her reframe it.
Yes.
Possibly.
Well, she's still got a little bit more work to do, I think, but she's put it together, and it will give anyone. It will give anyone else, parents, young adults, older people. It will give them a chance if they buy the book and read it. It will give them a chance to have that memory reconsolidated, and remind themselves that they're not at fault. Like Lucia went to the karaoke bar as a 15-year-old, and she shouldn't have. Can you imagine the guilt that she had about that? and then having to go home in the taxi all blooded and having to clean herself up and never say boo to anyone, and then go to school on Monday morning and tell everyone about the great time they had, and just chopped out the trauma. Wow. So I just recommend it for everyone, male, female, anyone, whoever. It's just, and she's a beautiful writer, and she doesn't have, she's a sense of actually patients do that too. She's a sense of just talking about it as though it's not really, Julie, how do you say it? Like it's someone else's problem. In therapy, patients will say, in a detached way.
People get good at being able to talk without actually experiencing the feelings. And again, that will help them be able to talk without anxiety. But if that's how you deal with your feelings all the time, again, that will hurt you, because we need access to our feelings. And then eventually, one of the great things about the memory reconsolidation is that you have memories there, but they just don't trigger you emotionally in the same way. You'll remember there was a terrible event, but you don't have the experience that you're at risk right now. And again, I think just this, it's not a one-to-one relationship between sexual abuse and trauma either, or between any abuse and trauma. That a lot of it is about the opportunity that you got for help. So we know with children that if something terrible happens to them and they have experienced that there's adults there who will understand and help them with it and make sure that it doesn't happen again, that has enormous impact on healing. And the same with adults. As adults, I think we have recourse to not more ways of getting help, but sometimes just due to these internal mechanisms that we've grown up with, we don't use those. It's not that it's anyone's fault. You can imagine that in even trying to talk about something, enormous anxiety comes up, then it can just seem easier not to talk about it. That can seem adaptive. It will also hurt you. So, also there's not leaving yourself alone with trauma. Not everyone's going to have that courage and the capacity to write a book. But at least finding someone that you're safe with, and if you need it, a therapist, like therapist that you feel safe with, to help you with that healing, so that it becomes a terrible event in your life that you heal from, rather than something that perpetuates, in some cases, lifelong suffering. That just in a way adds extra trauma on top of the initial trauma.
Julie, can you talk a little bit about not being believed? When the child isn't believed, what it does to the child. And also, as a young person, when they go to the police, they've got to prove that all this stuff happened to them, and what that does to the psyche.
Well, I think for children, it's very important for children to understand that they can lie to you, but they're not loved any less. So that that they can tell you anything, that sometimes children kind of come to understand that if they're going to say something, they need to say it in the right way that's acceptable to you. So I think with children that it helps to understand that everything's okay to say, and if they're caught out on a lie, well, lying cannot go well in relationships, but you're not less of a person, you're not loved any less. That then we help children to really be able to just be honest with themselves, what's happening inside of themselves, and to share that nothing has to be censored. I think, again, unfortunately, children learn that relationships go better if they censor certain things, whether it's things that, like not getting put out with online, or whether it's that they've got to censor and only let their parents know certain things. Don't let my parents know I did badly on that test at school, because sometimes they come to equate that with somehow feeling less of a person. And we can do that we can be very good at judging ourselves and expecting that our friends are going to judge us as well. That rather than noticing, if you've got a friend who judges you for something about you, then maybe they're not the right person to be a friend. Separate to that, I think it can be very difficult with the legal process for lots of reasons. I think, again, that that sometimes there hasn't been enough training, but also investigators need to establish the truth. They need to get clear on exactly what happened, and they need to make sure that there's enough evidence there that a court is likely to convict. And that can be a very difficult process. One, to have to talk with people that maybe you don't feel comfortable talking with. I mean, I think great that in lots of countries now there's more options for same gender police, or actually to choose, would you be comfortable telling your story to a male or a female? There's more sensitivity. I think there's also something about this process of needing to establish truth, that that police can't just accept someone's story on face value. Unfortunately, some people will lie, but there's still something about that process of when you get someone who's being honest, who's telling the truth, that they can have the experience that they're not believed. They've got to somehow prove themselves to be taken seriously. I think that's something that we still need to pay more attention to. How do we make sure that we gather enough evidence to hopefully have a successful prosecution without someone having the experience that they're already on trial before they ever get to court? I think, again, it's a very brave thing to be able to speak up. And unfortunately, I think in the past, our legal system has contributed to the trauma and suffering. Well, I was thinking, children are great if we can just help children to be authentic and spontaneous. Again, then we get to help them to shape their behaviour, and even to, so when that happens in your brother, does that kind of work ideally for you, or does it end up causing extra problems? What are other ways that we could help you with this? You're helping children to notice that, so that that children can have more authentic, trusting relationships, rather than having to mould and censor themselves to meet the expectations of others around them.
Yeah, to agree with them. Yeah, to keep their own feelings down, to keep other people happy. I just thought, when we were talking about how hard it must be to actually speak out, and then the legal system, or whatever you want to call it, the gathering of evidence, and that sort of then puts like that lack of trust back onto the victim, is what occurred to me, that the person who was the victim in that instance, almost as they tell their story, they can become victimized again, and letting that go is probably not easy when they haven't been able to speak about this sort of stuff. And we have all that evidence from the Royal Commission and all the Royal Commissions all over the world about institutional abuse and sexual abuse, and the difficulty of those people actually speaking up. And then it's almost like they're not believed, but it's not that they're not believed, it's that the judicial system can't hold the case or something. Is that how you'd put it? That the judicial system hasn't got the capacity to hold the case. It's not about a blame, is what I'm trying to
Well, I just think
bring
we
up.
have certain levels of proof that's required for a conviction, and unfortunately that means a witness has to somehow show credibility. And it's just a terrible situation. That the ideal would be for someone to be able to just tell their story and to know that they are 100% believed. Only our legal system doesn't work in that way.
No.
A small percentage of people that aren't truthful at times. So wouldn't it be wonderful if somehow we could just put people through some kind of a device that was infallible, and so they just tell their story and the court knew their story was 100% accurate, rather than having to go through a process where you have to convince people that you're telling the truth. People aren't necessarily going to say, well, just because you're saying this happened, we'll accept it 100%. So again, there's reasons why that's in place, but it just makes it, it can make it so much more difficult, people who are wanting to speak up.
Yeah, and that's what I mean about the blame, that then people will say, well, I wasn't believed, but it's not so much that they weren't believed, it was that they weren't able to, within the system, get the point across, is what I'm trying to sort of, anyone watching and listening, to be aware that, if you didn't get the outcome you wanted, it's about the legal system, it's about the investigative system, it's not necessarily about you, because we've got, all these things have to fit into a certain box. If they don't fit into that box, legislation hasn't been enacted to support what happened to you. I think, is that the best way of, trying to sort of back off from the reporting of it, and then just allowing that person to say, what happened to me didn't fit in a particular box, and it hasn't been developed yet, or something. Yeah. Can you talk about that, Julie, really, for a minute?
All a witness can do, all someone that has suffered can do, is just to tell their honest story. They're not responsible for the outcome of the legal process.
Good. Right. That's
and just
exactly
because they don't get the outcome that they want doesn't mean that they've done anything wrong in telling the story. It's not their fault. I think this is something that sometimes investigators can struggle with. They might put a lot of effort in. They're just there to present evidence to the court. They're not responsible for the decision that the jury make. So again, so that people understand that they can only do the bit. They can only tell their story. They're not responsible for the court's decision.
Exactly.
And also, if they don't get the decision that they think is a just decision, help in facing their anger. Again, that if they
Good.
get a decision that they're unhappy with, that they think is unjust, again, that doesn't necessarily have to hurt them emotionally. What will hurt them is if they bury their healthy anger about not getting what they think is a just decision.
Yes. Like repressing that anger, you mean?
Yeah.
Yeah.
Yeah. Yeah.
Okay. So when they've
And
repressed the anger, they go into pain.
well,
Yeah.
some
Do you
people
see
go into
the
pain,
mechanism?
some people
So,
go into depression. So there's lots of
yeah.
different mechanisms, but yeah, for a lot of
Yeah.
people, it's pain or specific physical symptoms and suffering in their
Mm.
body.
Yeah.
Yeah.
Yeah. So again, the system or the body, I suppose, the body keeps the score. You know, even further down the track, the trauma has happened like when you're 10 years old. You go through the explanatory sort of process, and then it doesn't have the outcome that you or your family wanted. So then the rage turns in on yourself rather than allowing it to sort of be examined and explored. Maybe would that be the best way of describing it?
Yes. Yeah.
Yeah.
And so then again, it just becomes about getting help to just face your feelings, the full extent of your feelings, including
Yeah.
the physiological aspect, so that you can release them out and they don't have to go back into you.
Yeah.
Excellent. Really excellent.
Julie,
it's wonderful.
Thank you for being with us, because this is a subject that's dear to our hearts as therapists, that it's not exposed or not talked about, and it's been repressed, and it's been okay. Like, kids are okay. They don't have to take the blame. You know, the circumstances of where you were at the time, you know, whether or not your parents knew or didn't know, or whether whatever, is not the issue. The issue is that it happened, and taking the blame is not going to help.
Right.
Again, we'll be here for quite a while, or I will.
Yeah. And we're going to invite
me.
Julie back when Lucia joins us. We'll invite Julie back, and the four of us can talk. Yeah.
And thank you very much.
Yes.
Very much for inviting me here. It's lovely to see the work that the two of you are doing.
Thank you.
Yeah. Thank you so much. Have a wonderful day. Good night to everyone. Good morning to Rose and to Julie, and to everyone out there. We're just thrilled that you came. And you can always ask your questions tomorrow. The next day, we're here at TMS RoundTable. And Rose, have a great day. I'll see you in 7 or 8 hours. I'll talk to you.
Okay. Sleep well.
Yeah.
The rest of the world and Australia, wake up and enjoy the day.
Bye, my dear.
Bye.